Many spinal injuries occur from dives into shallow water. It is very important to recognize a possible spinal injury and to use the proper techniques to promptly rescue and care for the victim. A person with a spinal injury will often be face down in shallow water. It's important to quickly move them face up while stabilizing the head and spine. The best way to do this is by using the head splint maneuver. Carefully approach the victim and grab her upper arms between her elbow and shoulders, trapping the head between the arms. Maintain pressure as you move the victim forward and roll her over. As she's rolling, lower yourself to neck depth, placing your forearm under the victim's shoulder for support. Check that the victim's arms are over your shoulder next to your ear. If the victim is on the bottom in a face-down position, approach the victim from above or behind, depending on the victim's position on the bottom. Trap the victim's head using the head splint rescue and transport him to the surface with the face angled toward the bottom to avoid getting water in the victim's nose and possibly into the stomach and lungs. Once you reach the surface, turn the victim to a face-up position. Transport him to the nearest side of the pool. Backboarding requires 2 rescuers. Rescuer 1 brings the victim to the side of the pool and checks for breathing. Rescuer 2 grasps the victim's arms and applies pressure to trap the head, maintaining the victim in a horizontal position. Rescuer 1 places a rescue tube under the victim's knees. He then checks for breathing again before retrieving the backboard and submerging it under the victim. With the backboard in place, Rescuer 1 attaches the chest strap, making certain the strap is snug and not under the board. He then holds the victim's head to the board by placing one arm on the victim's sternum and cupping the victim's chin with fingers on one side and thumb on the other. He then places the other arm beneath the backboard. After lowering the victim's arms to his side, Rescuer 2 takes a head immobilizer and positions it next to the victim's head. Then places the second head immobilizer in the same manner. The head strap is now applied. Rescuer 1 continues securing the victim to the backboard. He attaches the waist strap with the arms secure. Then moves the rescue tube from under the victim's knees to a position under the foot end of the backboard. The leg strap is then attached. All straps should be snug and clear of the underside of the board. A second rescue tube is placed under the foot end of the backboard if needed. The victim is now ready to be lifted out of the water. On the agreed upon count, both rescuers lift and slide the backboard onto the deck. Assess the victim and prepare for emergency care. To remove a spinal injury victim in water less than 2 feet deep, the head splint is first applied, trapping the victim's head between his arms. As the victim is being rolled over, Rescuer 2 places the backboard under him so that he rolls onto it in a face-up position. While maintaining the head splint, Rescuer 1 moves slightly to one side of the backboard as Rescuer 2 moves next to him at the head end. Grasping the backboard, Rescuer 2 drags the board and victim out of the water and onto the deck, as Rescuer 1 continues to apply the head splint. Someone who has a spinal injury will not necessarily be paralyzed, and may even approach the lifeguard on deck. Stabilize the victim's head and neck by grasping his head with hands on each side of his face near or over the ears. Tell the victim not to move until directed to do so. A second lifeguard should ask him, "Are you okay? What happened? Do you feel pain anywhere? Can you move your fingers? Can you move your toes? Do you have any pain in your neck?" Gently touch the back of the neck slightly to the right and left of the spine to help identify if there is pain in the area. It should not be unbearable pain. If the victim will be more comfortable, move him to a sitting position while supporting the head and neck. Call EMS and continue to support the head and neck until EMS arrives and assumes control.